think it's always worth stepping back and thinking about the outcome that we're trying to achieve. And the outcome that every healthcare professional is seeking is safe patient care. And I think the healthcare sector has done a great job recently in recognising that workforce optimisation is just as important as recruitment and retention. And that's reflected in the growth of things like telehealth, the improved use of healthcare professionals based outside of the UK or outside of the US, as well as AI. I think changes to and streamlining of patient pathways and the creation of new roles that will support the changes in the demand profile and volumes and the care delivery required over coming decades are critical. But kind of taking the point back specifically to the people shortages, I guess, for a moment, in terms of healthcare resourcing, there are two important principles that we work to with most of our organisations. The first really is supply chain augmentation rather than consolidation. That concept that talent acquisition needs to be viewed holistically across permanent workers and flexible workers, and every single available channel needs to have reach and has got to be optimized. And we need to think about, how do we provide attractive flexible working opportunities for people. And the second point that we regularly talk to people about is EVP and the link to employee shortages. So if you think about employer value proposition, on the global stage, the NHS is one of the largest and has traditionally been one of the most prestigious employers globally. I agree with Maz, the pandemic's raised the profile of health and social care professionals enormously, and we talked to lots of people about re-entry into the sector as well as training opportunities within the sector. But we do need to be conscious that kind of brand United Kingdom in some arenas has definitely been impacted by some recent events, including Brexit. The strength of the pound for international workers is weaker than it has been in prior years. And there's lots of fairly shiny and exciting opportunities for international workers to be elsewhere. So we need to work really hard to make sure that the NHS remains an attractive place to come and work or to stay and work. And it's both of those points. It's about recruitment and retention.